Indiana and Michigan. These are also states that have lost their industrial base, the automobile industry. Let me just see, got a question here. Curious to know if you have referred clients to acupuncture for pain management. I have, and actually it's interesting. Some health plans don't have restrictions on acupuncture the way they do on physical therapy. So those would be the two mainstays of ancillary or alternative approaches to pain medication. In our community, we have a Chinese-born surgeon who retired from surgery, but then got trained in acupuncture. In fact, he's an acupuncture trainer all over the world, travels to China and Japan to train physicians there in acupuncture. He's substance aggravated. So it might be at a moderately severe or severe level and then drop to a moderate level. So persistent depressive symptoms, the only way you know if they have them is if you track them. And the best way to track them is to use, the simpler rating scale. So that's why in those integrated systems of care, we encourage ongoing monitoring, not just of substance use, but of any of the symptoms here. So if I meet with a patient in my office and, systematically, I'm going to say, did you have many cravings? I usually say, did you have the opportunity to use since we met last? And I like to just ask about the opportunity. What substances are out there? What was that like for you? And just in an open-ended way, get them to narrate, what's been happening in the last week or two or four. And then just another sedative hypnotic. And so what I infer from this is that when the brain sees a downer and an upper, and you decide to stop using cocaine, but you don't really view alcohol as serious a problem, when you continue to use this, make sure my hand is, continue to use this, it stimulates through this common circuitry in here a craving for this. And so when I've used this way of explaining why we ask them to give up all mood and mind altering substances, they understand it. Not to mention, if you continue to drink, you're more likely just to run into opportunities to use, your primary substance. I was once a chairman of the addiction committee of the Medical Society for Baltimore City, and there was a physician there, I don't remember Frank's name, but Frank, certain other substances, and if they violate that contract. So it's much better to find it out immediately. And I have these little kits that test for 10 substances right in my office. You get an instant result. They're very accurate. And you get 3 opportunities to have them impact or leverage behavior. On the way in, what do you think it might be positive for? On the way out, I get them to read it. I'll just turn it. I'll say, what's it positive for? And then I'll look at it and I'll react to it. Well, I didn't know you smoked marijuana. How often do you smoke? And it's becoming more and more common that persons with chronic pain are going to go get medical marijuana for that chronic pain. So you have to form an opinion about whether that's acceptable to you. But I have a patient who's on buprenorphine. I knew he was using some cannabis every night, but then when